Welcome back to Premier League today. Now, having suffered an ACL injury in the Merseyside derby last month, Liverpool announced that Virgil van Dijk's surgery had been successful. But what exactly does an anterior cruciate ligament injury entail, and how does it affect an athlete's performance going forward? Virgil sat down with a specialist knee surgeon to find out more.
Today, I'm pleased to say that I'm joined by Mark Frame, who is a consultant orthopaedic knee and trauma surgeon at the University Hospital Southampton. Now, Mark, welcome to Premier League today. Now, we're going to be talking about ACL injuries, which for some viewers, they will have heard that term, particularly in football, when they've heard the phrase, a footballer's done in his ACL, he's suffered an ACL injury. Can you take us through the anatomy of the knee to start off with, and why cruciate ligaments are so important?
So it seems like a really small ligament. It's right in the middle of your knee. It's only about 2.5 centimeters long. So for something so small and so short, it causes such a big problem when you lose it. And it's so important in the stability of your knee. So it's interesting just to talk about how you injure it, because that kind of tells us what the role of your cruciate ligament is. The most common, particularly in football, is when they're jumping and landing from perhaps a header or a cross or something like that, and landing onto their foot and then twisting with their foot planted. And that's what your ACL is there to prevent your knee giving way by twisting too far. A bit like a rubber band, you pull too hard, that stretch goes and it just snaps. And that's exactly what happens with your ACL.
So, Mark, in the immediate aftermath of a footballer damaging his or her ACL, what would that player feel or even hear?
Typically, you'll hear that patients will report to us that they felt or heard a pop within their knee. And that's really, really typical. And it always amazes me because that's what's written in a textbook and that's what really sort of happens in reality. The adrenaline at the time cancels out any pain. So you don't feel the pain. They'll know that something bad has happened. You have that innate feeling that you're like, oh my God, something bad has happened. And they will often get up and try and run it off, because most injuries on the football pitch, you'll be able to run off, and it'll become very clear very quickly that they'll feel wobbly, like their knee's going to give way underneath them. And particularly with that hearing the pop, they'll walk off the pitch often. And it's within the first 20 minutes, half an hour after that injury is when it really starts to manifest itself.
Virgil van Dijk, when he suffered his injury on the pitch, it looked like he knew that he had done something serious. Liverpool haven't put a time frame on his recovery, but what will his rehabilitation look like in the coming months?
So his rehab will be very intense. Even somebody at a high level like that, an injury, you almost instantly lose a huge amount of your muscle bulk, just because you're not using it, because your body realizes that it needs to protect your knee. And that's going to be the biggest thing that it's going to take a long time to come back. So the first few months, really just about getting the strength back, getting his movement back, getting the swelling down. It takes up to 9 months to a year to be safely kind of back and playing contact, pivoting sports. I don't think anybody's extraordinary. There's no superheroes in recovery. There's nothing that a physio that necessarily can do. There's so many different milestones throughout your recovery and your rehab that gives the physios and the doctors an idea of how safe it is to let you go back. It's the same with rehab in sport, where somebody takes it upon themselves to feel that, okay, I'm going to go back a month early. I know that there's a possible risk that I could do some harm, but the benefit of me going back or trying to achieve what I want is so important that they balance that up in their mind. So I've no doubt that a lot of it's to do with confidence, and a lot of it's to do with the different way people approach risk.
There have been other players who've returned after an ACL injury, and I'm thinking about the likes of Alan Shearer, who had that injury quite early on in his career. They recovered really, really well, and they went on to have stellar careers. I mean, Shearer went on to become the Premier League's top scorer, and he remained so. What helps in that process, coming back stronger from an ACL injury? What kind of factors will be involved in that?
Again, definitely confidence is something to do with it. Some people really lose their confidence in that kind of attacking ability once you've had a major injury, where you kind of almost have flashbacks and think, I don't want that to happen. My career is so important. And they just hold back that little bit, and that just holds their career back a little bit and the progression in the sport. Around about 80% of elite sports people that have an ACL injury will come back to that same level or higher. And that's within the first year after their injury. But that number drops dramatically at about 3 years, where you can be down at nearly 50% of people that have had that ACL injury are still functioning at that level. So I think those numbers are quite clear that it's a pretty devastating injury to your knee and has consequences.
Okay, thank you so much, Mark. It's been a fascinating chat about everything ACL injuries. I hope our viewers have enjoyed it and have certainly learned something from this chat, because I know I certainly have.
Well, I hope so. Thank you very much for asking.
Yeah, really insightful there from Virgil, and it's very appropriate that we do have you in the studio, because I'm watching that the whole way through. You were jiggling around your paw knee, because of course you did do it when you were at West Ham. What I also thought was interesting is you told us you know exactly when you've done that injury because it makes a specific sound.
That's exactly what you hear with the pain. And then the pain lasts for, I don't know, 3, 4, 5 seconds, and all of a sudden the adrenaline kicks in. But you know, I knew mine happened just before half time, so I was trying to...
Sorry to make you...
No, it's fine. It's absolutely fine. It's a long time ago. So I'm trying to chase Frank or Drew, and I hyperextend, and you can just see, you know straight away, you can tell from a player, so it's my right knee, and you just grab your right knee. And what your knee is not designed to do, like the surgeon said there, it's not meant to go into hyperextension. Your knee can function by going different ways, and it can flex to the left and to the right, but it's never, ever meant to go back into hyperextension. And that's how I've done mine. And it's a really painful, brutal operation.
And what about when you came back? Were you the same player? Because I imagine there are two recoveries, the physical and the mental recovery.
I struggled. I mean, first and foremost, when you do an ACL, and for anyone who's watching who's going through the process, and the surgeons always tell you, in about 4 months' time, you will feel $1 million. You'll feel I can get boots on, I can get trainers on, I can go out running. But that's the phase where you have to ease back, because that's when everything's just starting to knit together. You know, my operation was hamstring, so they took 2 inches of my hamstring to use as the graft. It used to be patella tendon. I think Paul Gascoigne, I think Michael Owen had a deceased Achilles tendon that used as the graft. So there's loads of ways to do it, but the modern day is the ACL, is the hamstring. And then once you get past that 4 months, 5 months, 6 months, there's light at the end of the tunnel. You get your trainers on, you start running straight lines, you start twisting and turning, then your boots come on, you start to get integrated with the other players. You can start doing little bits of football, but I mean like tiny little bits. And then I come back after about 9 months, and I was never the same in my head, and I knew I wasn't right, even though my body was telling me, and my knee and the doctors were saying, look, you're good. Like, we've scanned you now, the graft is healed, you're good to go, you can train. And I trained, and I just literally, I think I jogged for like 90 minutes, just doing nothing.
Just quickly on Van Dijk, can he come back as the same player?
Yeah.
He'll come back as the same player because he's physically bigger and stronger than I was, and a lot younger. You know, I was 30, 31 when I had mine. So he'll come back. And this one I didn't know, because I couldn't quite see his knee go into hyperextension until you see it in, and he's brave. You know, he looks a brave boy there, where he knows there's damage, but he wasn't stretching off, and he actually walked off, which I find absolutely incredible, because every ACL injury that I've seen, everyone gets stretching off. So the rehab, the surgery, everything has to go well, and he's got the best people looking after him. And you get to a point where I was at 10 months, and everyone was telling me, look, I'm good to go. And I was training with the first team, and Glenn Roeder put a 7v7 session on, where it was like sort of orange bibs versus green bibs, and you give me like this sort of black bib, if you like, as if to say, no one can touch me, you're playing for both sides. And Thomas Repka, our centre-half, who was an absolute lunatic, went straight through me, lifted me up in the air, I dropped down the floor and went, I'm back.
And you didn't look back from there?
I didn't look back, I was back.
Well, thank you so much for being with us on the sofa today. I tell you what, we're excited about the international break being over. I bet Jurgen Klopp is as well. 8 first-team players out for Liverpool now. A few of your tweets as well. Richardson has said Everton and Burnley will be struggling this season. Thank you all for getting involved today. We'll see you on the sofa very soon. Bye-bye.